Hello everyone. Welcome. We're so excited to have you join us for today's webinar on Medicare, what you need to know in the COVID-19 era. My name is Linda Williams. I am a community outreach and training manager with Consumer Action, and we have a great webinar for you today. Our guest speaker is Micki Nozaki. She is the director of the California Senior Medicare Patrol, and we are so thrilled to have her with us today. You are in for a real treat. Before I introduce Micki to you, let me go over a few housekeeping items. Today's webinar is being presented with funding from Consumer Action's Insurance Education Project, which is part of our COVID-19 education project. As the announcer indicated, when you join the webinar, you are in listen only mode. However, if you have questions, and we hope you have a ton, you can use the question function on the right of your screen to type in your question. So please take a quick minute and find the function, click it on, open it up so you're ready to go. If you're on Twitter, you can use that platform to ask your questions. Our organization handle is at Consumer Action, and you can always use our go-to hashtag, which is CA Webinars. My colleague, Nelson Santiago, he's going to facilitate the question and answer segment, which will follow our feature presentation. The webinar is being recorded and it will be made available to you tomorrow afternoon via Dropbox. Now, you don't need to have a Dropbox. We are providing the Dropbox. All you need to do is click on the link that we send you. Also, very important, at the end of the training, we will send you a webinar. Please complete the webinar, complete the survey before you sign off on the webinar. The surveys are really important to us. It helps us continue doing the work that we're doing. So what is it that we do at Consumer Action? Well, as it says under the Welcome to Consumer Action on the screen, through education and advocacy, Consumer Action fight for strong consumer rights and policies that promote fairness and financial prosperity for underrepresented consumers nationwide. How? Consumer Action advance consumer rights nationwide by referring complaints through our national hotline, by publishing educational materials in multiple languages, through our monthly newsletter, The Insider, our quarterly publication, CA News, and through outreach and the free trainings that we provide, like this webinar. We've been around since 1971. We just celebrated our anniversary. So we love what we do. Since so many agencies are new to us, I thought I would take a couple of seconds just to show you how you can go to our website and download our free educational materials. So let's say you're seeing a lot of cases regarding ID theft, especially since COVID-19 hit, and you're interested in a training module. Well, you would go to our website. The address is there at the bottom of your screen and on all the materials you receive from us. You will go to the quick menu, and under the quick menu, you will select a you will click select a training module. Scroll down to ID theft and account fraud and click, and voila. You will be led to publications that we've created regarding identity theft. If you're interested in our COVID-19 project, you just click on the dark green bar and you will land on our COVID-19 educational project page. When you're on that page, you can click on the words research guides, and and it will take you to valuable resources for consumers impacted by COVID-19. You click on the words fact sheets, and you will find fact sheets like the one featured to the right, like making a career transition on or one on fair housing issues. If you click on webinars, you will find all of the recordings of past webinars, like the one on fair housing, basic estate planning, and also domestic violence. Now, we are a 501(c)(3) organizations. We're supported by membership, donations, and grant. At the end of the webinar, there will be some information available to tell you how you can donate to Consumer Action. Now, let's take a look at the agenda. At Consumer Action, we believe in making learning fun, so we open up just about every training with our most popular game, How Much Do You Know? So we have 4 poll questions for you. After the game, we will move into our feature presentation. After the presentation, my coworker Nelson Santiago will come on and he will facilitate the question and answer segment. I will come back, I will wrap it up and tell you how you can donate to Consumer Action. So let's let the games begin. Let's start with our first survey question. The most basic forms of Medicare fraud are phantom billing, patient billing, upcoding, and unbundling. Is that true or is that false? Don't overthink it. Don't overthink it. Okay, let's close the poll and get the results. So 90% of you think it's true and only 10% think it's false. Well, 10% is true. Let's move on to the next question. Medicare covers 4 vaccines for seniors: flu, shingles, pneumonia, and hepatitis B. Is that true or is that false? Medicare covers 4 vaccines for seniors. Is that true or is that false? Couple more seconds. Okay, let's close the poll. 79% is saying it's true, and only 21% is saying says it's false. Well, 79%, you are absolutely right. That is true. Let's move on to the next question. To be eligible for Medicare Part A and B, you must be a U.S. citizen or permanent legal resident for at least 5 years. 5 years? Is that true or is that false? Couple of more seconds. Okay, let's close the poll. So 55% is saying it's true and 45% says it's false. 55%, I'm sorry to say, it is true. You are absolutely right. Let's move on to the last question. It is unlawful for providers to routinely waive coinsurance requirements because it results in false claims. Is that true or is that false? Okay, a couple more seconds. All right, let's close the poll. 64% think it's true and 36% think it's false. It's actually true. Okay, so let's move on. Thank you so much for participating in the game. It's actually a tease for the great presentation that's going to follow. So let me, without any further ado, just introduce you to our guest speaker. Let me tell you a little bit about her. Micki Nozaki joined the CHA staff with the California Senior Medicare Patrol in the fall of 2011. She has previously served as a health insurance counseling and advocacy program counselor offering in-person Medicare counseling at sites throughout Orange County. Her professional experience includes 25 years in the private sector for mainly healthcare, insurance, and government contracted organizations, where she led the development, implementation, and promotion of information security and privacy programs. She has a BS and MBA from the University of Redlands. She is an animal lover and strives to be an avid golfer. So get ready to be amazed. Take out your pencil and your paper and get ready to take some notes because she is a dynamic speaker. Let me turn this over to her. Okay, Micki, you can take it away.
Okay, how's my volume, Linda?
It's great.
Oh, terrific. All right, thank you so much, Linda, for the introduction. I appreciate that. And let's just move on here. Hi, everybody. I am very grateful to have this opportunity today to talk to you about Medicare and the serious effects of fraud on health outcomes of our most vulnerable beneficiaries, especially since fraud is even more unchecked during this COVID pandemic. The agenda for today, we're going to talk about the consequences of fraud, not only in taxpayer dollars, but in human costs and patient harm. A little bit about basic Medicare information, because we need to understand Medicare in order to avoid the pitfalls of fraud and abuse. Now, there have been some changes about Medicare coverage, especially around the pandemic. So we'll talk about a few of those, and then we will cover some of the current healthcare fraud schemes that we have been seeing. So for many, many years, we recognized that fraud and abuse contributed to so much unnecessary spending in the Medicare program. Now, if you look at the numbers on the screen, we spend almost $800 billion a year providing health care for over 60 million Medicare beneficiaries, people over the age of 65, and persons living with disabilities. The tragic part is that at least one of every $10 spent is lost to fraud, waste, and abuse. $75 billion every year. And over the years, the agencies of the federal government have prioritized getting the money back, restitution, as well as excluding those bad actors from the system. Nevertheless, the human costs of fraud and abuse in terms of patient harm were not hardly regarded. And I want to point some of these out to you now, because this is the serious part of Medicare fraud. Take the owner of a diagnostic facility who employed fake doctors. Not only did he defraud Medicare and Medicaid for millions of dollars by creating false radiology reports that were never even ordered, he used unskilled and untrained employees to interpret the x-rays, the ultrasounds, and the cardiac examinations of elderly patients in the local nursing homes. And because these people were untrained, the employees could not interpret the serious medical conditions and didn't identify congestive heart failure in at least 2 elderly patients. And this gross malpractice cost these 2 patients their lives. Neither patient got the care they needed. Both ended up dying from their condition. And we'll never even know how many other unfortunate persons suffered from this doctor's unconscionable greed. And unfortunately, this is not an anomaly. Look at on the right-hand side of your screen, 3 more instances of Medicare fraud. The cardiologist who got 20 years in prison for performing unnecessary catheterizations, tests, stent insertions, coronary artery bypass surgeries, all unnecessary, all to line his pocket at the expense of patient safety and well-being. Or the eye doctor, the retinal specialist, who lied to his elderly patients, convinced them that they had serious retinal diseases, and then proceeded to blast their eyes with torturous laser procedures, billing Medicare for over $70 million in fraudulent claims. Or the hematologist oncologist who gave cancer treatment drugs to patients who did not have cancer. Painful and life-altering chemotherapy to over 550 of his patients. In fact, he even kept giving poisonous chemo drugs to patients who were in remission. Some of his patients died, and many are living today with serious disabilities because of his egregious conduct. That's big time Medicare fraud. Now let's take a look at Medicare, because as I said before, understanding Medicare is imperative to knowing how not to fall victim to the fraud and abuse. Medicare is complex and it's complicated, and many times it's challenging for the consumer to navigate. But make no mistake, the fraudulent billers and the scammers know the system very well, and they take full advantage of it. So on the left-hand side of the screen, we see Medicare, Original Medicare, also called fee-for-service Medicare. Original Medicare is Part A and Part B. Part A is the hospital insurance, the inpatient hospital stays, care in a skilled nursing facility, hospice care, some home health care. And Part B is what we call the medical insurance, doctor services, medical supplies, and preventive services. The government provides Original Medicare Part A and Part B to American citizens and permanent legal residents who are age 65 or older, and persons under the age of 65 who have received disability benefits for 24 consecutive months. Now, Part A and Part B have deductibles, co-payment, and co-insurance that applies to certain services. Persons having Original Medicare Part A and B pay 20% because Medicare pays 80% of the services. Now, in order to bridge the gap of that 20%, Original Medicare beneficiaries can purchase a Medicare Supplement. That's called a Medigap. It's an insurance plan which bridges the health insurance coverage gap in Original Medicare. Supplements, Medigaps, are provided through private health insurance companies, and their costs may vary. All supplement policies offer the same basic benefits, but can offer additional benefits. So knowing choices is really important. Some Medigap policies, by the way, also cover services that Original Medicare doesn't cover. For example, medical care when you travel outside the United States. Now, if you enroll in Medicare and you choose Original or fee-for-service Medicare, in addition to Part A and B, you still want to cover the cost of your prescription drugs. So individuals then can purchase a Part D prescription drug coverage to cover the cost of their medications. Now, if you don't choose to go Original or fee-for-service Medicare, you can, in essence, turn your Part A and Part B into what they call a Part C, which is on the right-hand side of your screen, a Medicare Advantage plan, also known as an HMO or a PPO, Preferred Provider Organization. Medicare Advantage plans are offered by Medicare-approved private companies, and they all have to follow a whole set of rigorous rules set out by Medicare. And there are a lot of Medicare Advantage plans. Last year, in fact, I think there were over 400 Medicare Advantage plans in California and over 3,500 across the country. Now, their out-of-pocket costs may vary, and many Medicare Advantage plans also include the prescription drug coverage part. So Part C also has a prescription drug benefit. That's called the Medicare Advantage Prescription Drug Program, MAPD. Now, I know that's a bunch to digest. Additionally, Medicare Advantage plans many times offer either a zero or a very low monthly premium. And increasingly, especially with this pandemic, Medicare Advantage plans can offer a whole slew of additional benefits, meals, vision coverage, hearing aids, gym memberships. So again, informed choices are imperative. So some of the important things to know, these bullet points in red here. As you can see, beneficiaries need to know a lot about what's available in order to make informed decisions. They need to be very careful when choosing original Medicare or a Medicare Advantage plan, but especially a Medicare Advantage plan to make sure that their doctor they want to continue to see and the medications they take are available in that particular plan. That's why it's so important to understand the ins and outs of what is available in that particular health plan, especially since some rogue insurance agent can't talk you into enrolling in a plan that's just not right for you. Timing. Timing is essential. Late penalties can be imposed if certain enrollment dates are missed. And this is an important point as well. It is illegal for you to have a Medicare Advantage plan and a Medigap supplement at the same time. And if someone tries to sell one, they're scamming you. And a lot of older adults and persons living with disabilities, they have very expensive medications. So not only is it important to compare plans, you don't want to fall for some scammer who tries to sell you a discount prescription card. Oh yeah, we've heard of those. And another thing to know, under the Medicare Advantage column, down at the bottom, we see star ratings, which are available at medicare.gov. Medicare Advantage plans do surveys. Every year, they survey the providers in their network, and they survey the beneficiaries, the members of their plans. And they do what they call star ratings, which are in essence quality and performance ratings. Ratings that rate the plan from 1 to 5, 5 being the highest score. So again, that's another way for people to be able to find out how a plan rates in order to make that very important informed choice. Now, I know we went through this very quickly. We can talk about Medicare all day, every day, and I'm hoping that we can do a more extensive coverage of Medicare and its information at another time. Okay, so very complex, very complicated, but you can see how important it is to understand all the ins and outs. And in addition to being complicated and complex, Medicare doesn't stay the same year over year. There are always changes, important additions that folks need to know about. And again, the more educated we are, the less likely to fall victim to the fraudsters and the scammers. Now, Medicare is confusing enough in normal times, but given the pandemic, Medicare's rules are changing, and it's hard to keep up. There are waivers, extensions, additions to the waivers, additions to the extensions. And oh, by the way, these changes can differ by state. And due to the pandemic, some of Medicare's coverage and payment rules have been modified. So here are just a few we need to talk about. Medicare ensures broad coverage for COVID testing. Medicare Part B covers the lab tests for COVID-19, including the FDA-authorized COVID-19 antibody test. And Medicare has waived the requirement that there be a doctor's written order for the test during this pandemic. Also, Medicare Advantage plans must provide coverage for COVID testing, including the associated cost of the provider visit. Now let's talk about telehealth. In order to accommodate people hunkered down in their homes, not wanting to go and make a doctor's office visit, Medicare also recently expanded coverage of telehealth. There are now more than 240 telehealth services available. Now, telehealth, remember, uses audio and video technologies such as Zoom to have a consultation with your provider. Now, the services provided under telehealth coverage include not only the consulting part with your doctor, but also things like remote physiological monitoring, therapeutic exercises, occupational therapy evaluations, and so much more. Telehealth changes the way we do healthcare. But unfortunately, it opens the door to fraud and abuse. So there are some important things to know about your telehealth appointments. Number one, they have to be prearranged. Number two, they have to be documented by your provider in your medical record. And importantly, if someone gets an unsolicited call about making an appointment for telehealth, they should verify with their own doctor to make sure it's legitimate, because we've heard about those scams. Now, we also know that Medicare, Medicaid, and Medicare Advantage plans will cover vaccines. Under a new interim rule, in fact, Medicare came out with this rule at the very, very tail end of October. Medicare, Medicaid, and private insurers all are required to cover the COVID-19 vaccine without any out-of-pocket costs for beneficiaries and plan members. Now, that, of course, is when the vaccines are available. But again, we've heard of scammers who are calling people up and offering a COVID test for $250 out of pocket, and people are falling for it. Now, in keeping up also with the easing of the regulations, Medicare Advantage plans and the Medicare Advantage prescription drug plans have the ability to waive or relax the requirement for prior authorization for certain services. And lastly, the last bullet here I think is very important. Starting during this particular open enrollment season, which has begun, if a person has ESRD, that's end-stage renal disease, they can enroll in a Medicare Advantage plan during this open enrollment season, which ends December 7th. And their coverage will start January 1st of the following year. Another point to remember, though, in many cases, the person doing that needs to use healthcare providers who participate in the particular plan's network and service area. So before someone enrolls, they need to check with their providers and make sure that they are included in the plan, the Medicare Advantage plan they choose. to make sure the providers they currently see, that is the dialysis facilities, the kidney doctor, all in that particular health plan's network. So many things to know, so many things to remember. Now, fraud prevention, I'll tell you, it's a challenge in normal times, but these are not normal times. And the coronavirus pandemic has fostered an environment that is so ripe for the scammers and the fraudsters. Just as we spoke about, the rules are changing and the scammers are taking full advantage of any confusion that the pandemic has created. So let's take a look at some actual COVID-19 billing scams that have been reported to us in the last few months. We got a report from a beneficiary who received a COVID-19 test at a drive-through testing event. Now, apparently, the people who were doing the testing told this beneficiary they also needed to take 4 vials of blood. Well, the beneficiary agreed to it, but when she reviewed her Medicare summary notice, she thought so the testing provider had billed Medicare for $12,000 worth of tests. I think there's a little bit of fraud there, huh? In another case, it was reported to us that a senior foundation had sent an individual to a beneficiary's home, again, to do a COVID test. And after the beneficiary reviewed his medical statements, he saw that Medicare has been billed for what they call an upcoded office visit, which is a lot of money, and chronic care management. Might be a little bit of fraud in there, huh? Next, we received a report of a COVID-19 testing site, which was set up, interestingly, within walking distance of a senior housing site. The testing site was actually a tent where employees were standing and offering free COVID testing, but they required that each person show their Medicare card. I wonder what they're going to do with those Medicare numbers, huh? And an interesting note about this particular testing site, they also offered free weight loss services, hormone therapy, and vitamin supplements. You might be a little suspicious. Next, we've heard about scammers who are calling older adults, pretending to be employees from their particular health plan, telling seniors that they've called to set up telehealth appointments. And while they're on the phone, they're asking for Social Security numbers, Medicare numbers, banking information, and credit card numbers. That does not sound kosher. And lastly, now this is a very recent scam that we've heard about. It's a text message that people are receiving. And the text message says, you have received a direct deposit of $1,200 from the COVID-19 Treasury Fund. The text message goes on to say, further action is required to accept this payment into your account. Continue here to accept this payment. And then the text includes a link to a fake web address impersonating the Internal Revenue Services website. And individuals who visit the fraudulent website and then enter their personal and financial account information, well, it's going to the scammers, folks. So we need to let people know. IRS does not send people unsolicited texts or emails. And the IRS does not call people. They don't threaten them with jail time or lawsuits. And it certainly does not demand tax payments in lieu of gift cards. Yeah, that's what the scammers are doing. Now here's another one, and this is a scary one. This is another true story our investigators told us about. This is a gentleman named Alec. Alec is a 93-year-old, frail, Armenian-speaking gentleman who was sitting by himself in a coffee shop in Southern California one day when a marketer approached him, a marketer working for some unlawful doctors. And he said to Alec, you know, I can take you to our office and get you a free COVID-19 test. And all you need to do is prove that you are Medicare eligible. Well, unfortunately, Alec took his Medicare card out of his wallet and showed it to the marketer. And the marketer said, well, you're eligible, okay. He took him about 12 miles away from the coffee shop to some office building. Now, Alex sat there for a couple of hours. Nothing happened. And then thankfully, he was returned to the coffee shop. But weeks later, Alex's caregiver was reviewing Alex's Medicare summary notice. And look at what he saw. Fake charges, false billing to Medicare for $700 for pneumonia tests, over $500 for ultrasounds of his head, neck, and abdomen, and even a $200 claim from a podiatrist for the removal of thickened skin. All false claims, all services Alec did not receive. Oh, and by the way, Alec never did get his COVID test. It's another example of Medicare fraud. Now, if you think that was bad, let's talk about the egregious scheme of tricking vulnerable people into signing up for Medicare Hospice, even though they're not terminal, and the disastrous implications that occur when that happens. Now let's talk about hospice for a minute. Medicare Hospice. It is a Medicare benefit, remember, under Part A, and it's a blessing to a lot of people. People who are terminally ill, people who are expected to pass away within a few months. And the hospice coverage provides a way for those beneficiaries to get comfort care, which means that they're made comfortable. But hospice care does not provide curative care. It doesn't cover the health care for the terminal condition. So when people are tricked into signing themselves into hospice, they give up curative coverage for the terminal condition. And that's okay if it's legitimate, if they're terminally ill. But what if you're not terminally ill and someone tricks you into signing up for hospice coverage? Let me give you two examples, two true examples of how this occurred. Just two of many that we've heard about. Etta, a 77-year-old Russian-speaking woman from Los Angeles. Now, she speaks only Russian, so her husband usually helps her with the English language and her medical coverage. But her husband wasn't with Etta when she was in the hospital, recuperating from breast cancer surgery. A woman approached her with some paperwork, explained something about Medicare, free home health services when she was discharged from the hospital. Well, Etta didn't really understand any of this, but you know, this person was in the hospital. They were in some sort of a uniform that looked like they worked at the hospital. So Etta signed the paperwork, which were enrollment papers for Medicare Hospice. And again, because hospice is meant for only comfort care, Etta and her husband struggled for almost a month trying to get the new medications that were prescribed to her. Why? Because the pharmacy denied each and every claim for the new medications. He saw on her record she was enrolled in hospice, and hospice people don't get the curative medications. It took almost a month working with us to be able to get those medications for Etta. One just serious implication of being enrolled in hospice when you shouldn't be. In a similar situation, Thomas was a 76-year-old Vietnam veteran with severe post-traumatic stress disorder. One day he was approached, undergoing his dialysis treatment, again, by an individual who looked like he worked there, and he told Thomas that he needed to sign papers. Now, Thomas, again, he was confused, but he did as they asked. He signed the paperwork, and he found himself enrolled in Medicare Hospice. He wasn't terminally ill. And then he found out that he had a whole bunch of denied claims on his Medicare record, in addition to suspicious charges for durable medical equipment that was charged to his Medicare record that he didn't need, he never got. False claims, Medicare fraud. So Etta and Thomas, two vulnerable victims of fraud, targeted by criminals, only for the sake of greed. Now, let's talk about what we call the telemedicine back brace scam. This is telefraud. Basically, scams that leverage aggressive telemarketing. And we're talking widespread. I mean, this is one of the most prevalent scams across the country. Now, let's dig a little bit deeper into how this scheme works. And if you're like me, inundated with robocalls and telemarketers, I think you'll recognize the signs. So on the left-hand side, we have the telemarketers. They sit in call centers that could be in Texas, Florida, India, the Philippines, anywhere. And those telemarketers spend all day, every day, calling thousands and thousands of unsuspecting seniors to get them to give up personal information like Medicare numbers and other personally identifiable health information. And they're pretty successful at it. And when the call center marketer confirms that an individual is on Medicare or Medicaid, they say, great, Medicare wants you to have a free back brace, and we have your information now, and I'm going to transfer you over to the teledoctor for a consultation. So the telemarketer on the phone with the unsuspecting senior transfers that person over to a doctor. Now, these are real doctors, but they're bad doctors. They're only doing it for the money. So they create false diagnoses and they authorize orders for this particular senior for unnecessary braces. They either talk to them for a couple of minutes or they don't talk to them at all. And they've never seen these people. They don't know that they need a brace or not. They don't know if it's medically necessary. They don't care. They're only doing it for the money. And once they have all the information, the Medicare number, the date of birth, all of the information, they write a false order authorizing the braces, and they send it on to the unlawful equipment companies. And then, of course, the equipment companies have all the information necessary to bill Medicare for thousands and thousands and thousands of fraudulent claims in equipment, unnecessary equipment. And remember, of this whole picture here on your screen, the people missing from the picture are the unsuspecting older adults and disabled people, the victims of the telemarketers, the people who have false claims now recorded on their Medicare records. And this scheme, this telemedicine back brace scam, it all starts when the unsuspecting senior picks up the telephone to a strange call. This is how a lot of people get scammed. The telephone. The telephone is the most common method used to target our most vulnerable people, the isolated, the lonely, the elderly, the demented, many times the non-English speaking seniors. A recent Pew study, in fact, showed that over 50% of individuals aged 65 and older now have smartphones. And as you can see from this chart from the Federal Trade Commission, it clearly demonstrates that scammers target people older than 70 using the telephone. And pretty much it's the only way that folks over 80 are targeted by the scammers. I mean, if you're like me, I'm at my mom's house, she's 93, the telemarketing calls, they never stop. It's crazy. Now, down at the bottom of your screen, you see a little script. I do not give out personal information in an unsolicited call. This was a very handy tool I saw somebody suggest. Although we tell people it's not the best idea to pick up the phone if you don't know who it is, many people do answer the telephone. You know, sometimes they're worried that they'll miss a call from their family or their doctor. So for many of us who may be caught by surprise by a strange caller or a telemarketer, it might be good to have this little script written down by the telephone. So when somebody calls, because those telemarketers are so clever and they know exactly what to say to get that information out of you, all you need to do is read the little script and just say, I don't give out personal information in an unsolicited call, and hang up. Not a bad tip. Now, let's talk about Medicare and annual enrollment season. We know it's the right time of the year when folks start getting these innocent-looking postcards in the mail. They can be pink, yellow, blue. Well, regardless of the color, the postcards are targeting Medicare beneficiaries, urging them to call the 800 number right away to find out about their Medicare benefits. Some of these postcards even use scary language like, don't lose your eligibility. All they are lead generators. If you respond to one of these postcards by calling the 888 number, you in essence have given permission for somebody to call you, and they're going to call you about insurance. Okay, so we need to let people know. Just throw those cards away. Shred them first, and then throw them away. Because we are absolutely in the middle of Medicare election season. This is an important time of year, folks. Started October 15th. It's the time of year when Medicare beneficiaries can evaluate their current plans, and they can change plans. They can leave a Medicare Advantage plan and return to original Medicare. Conversely, they can leave original Medicare and enroll in a Medicare Advantage or a Medicare Advantage with prescription drug plan. They can go from one plan to another. They can join a prescription drug plan, and they can change from one drug plan to another. And as we said, it's really important at this time of year to evaluate your choices. I mean, there's some money that could be saved. But there are scams as well. So let's look at some of the Medicare open enrollment, Medicare election season scams that we have seen. Now, Medicare does put out a whole set of rules and guidelines for what marketing violations are and what agents and solicitors can and cannot do. And although insurance agents, for the most part, are legitimate business people, there are those rogue agents out there, and we need to know about them as well. So as we said before, it is illegal to sell a Medicare Advantage plan member a Medigap, a supplement. They cannot have the two together. It is against marketing violations to pretend that you represent Medicare or you call yourself a healthcare specialist when in actuality you are an agent or a solicitor. It is not allowed to tell beneficiaries that they have to change their plan every year. It's not true. Don't scare people. They can change if they want to, but they don't have to. And of course, and I know it sounds like common sense, but agents do try to sign people up for plans that they don't need, not appropriate, or don't even exist. Also, agents are not allowed to approach people in common areas. We've seen people approaching individuals walking in and out of the supermarket or Walmart or Target. We want to be very careful when we see something that looks too good to be true, like prescription discount cards that are for sale for $299. Or if you see a text message or an email offering something like a 61% discount on a new health insurance plan. Could be scam. Be careful. And this is what I would always recommend during this season and during any other season that may not be open enrollment season, but people are always looking for Medicare coverage. Contact the state health insurance program known as the SHIP. I always recommend that folks trying to figure out Medicare and their health care contact the SHIP, and in California called the HICAP, the Health Insurance Counseling and Advocacy Program. The HICAPs and the SHIPs are available across the country, and they're available in county-specific areas, which is really important because health plans can vary from state to state and county to county. The SHIP and the HICAP programs are set up so that educated, licensed staff and volunteers can consult with people on Medicare, Medicare Advantage, Medigaps, prescription drug programs, all so that consumers can make informed choices. So you've got the HICAP 800 number here, which will take you to the appropriate county HICAP. And if you're outside California, your state health insurance program can be located at the shiptacenter.org. Now, the SHIPs and the HICAPs, they're our partners, and we are the California Senior Medicare Patrol, one of 54 programs across the country, focusing on educating people about fraud prevention. We host, as the other Senior Medicare Patrol programs do across the country, a toll-free statewide hotline We offer free services, including fraud prevention workshops, such as the one you're listening to now, fraud advisories, educational webinars, newsletters, and also importantly, assistance to Medicare beneficiaries, families, and caregivers to help them research medical billing, to understand their medical statements, and if there is anything suspicious, to refer those potential fraudulent billings on to the authorities. Sometimes we find that people are hesitant to question their doctors about billing issues that they might see on their statements. We'll help. It's definitely not so easy to understand Medicare, especially for the average layperson. So we can help. And as far as fraud prevention, the Medicare Senior Medicare Patrol program has a three-prong approach. It's called protect, detect, and report. So if you look at this screen, protect, number one, protect your Medicare card like it's a credit card, because Medicare fraud is all about medical identity theft. Medicare fraud cannot happen unless the fraudster or the scammer uses someone's Medicare number to lie, cheat, and steal from Medicare, and victimize the beneficiary as well. So the key message here is to protect the Medicare card like it's your credit card. Even though that little red, white, and blue card has this kind of scrambled alphanumeric combination and the Social Security number is no longer on there, it is still vulnerable and golden information to the scammers and the fraudsters. So that's protect. Now, number two, detect. On the right-hand side of your screen, you see a little snippet of a Medicare summary notice. One of the best ways to know if a doctor has billed you fraudulently is to review your medical statements, the Medicare summary notices, and the explanation of benefits. They come routinely, and they show what's been billed under a person's individual Medicare number. And lastly, number three, report. Report fraud. It's so important because we have to get the bad actors out of the system. We have to report. In California, you can report fraud and scams to our toll-free number there on the screen, 855-613-7080. And again, if you're outside California, you can find your Senior Medicare Patrol program located at smpresource.org. smpresource.org has a state locator for every Senior Medicare Patrol program in the country. So in conclusion, this is a call to action, folks. Not only do we as taxpayers lose billions of dollars a year in fraud, waste, and abuse, healthcare fraud significantly affects the safety, the well-being, and the welfare of our beneficiaries. And unfortunately, we can't prosecute or legislate our way around it. The criminals will always be a step ahead. So education and awareness, they're imperative. We have to articulate the risks and disseminate this important fraud prevention education. And I know we can do it. We can do so much together to protect our minorities, our disabled, our low income, our seniors, which is why I am so very grateful to have this opportunity to share this information with you today. I want to thank you for your attention, your interest, your partnership. My contact information is there on the screen. If you do believe that this information could be of benefit to your clients, your residents, your partners, if you belong to another organization, a church, a synagogue, a retirement group, let me know. I can do this or a similar presentation for you virtually until we get to do things on site once again. So again, thank you so much for your attention.
If you would like to contribute to Consumer Action, you can do so online by credit card or PayPal, or you can mail a check to Consumer Action Attention Giving. Um, Again, I want to thank you for joining us today. Did we meet your expectations? Please remember to complete the survey before you sign off today. Watch your inbox for an invite to our December the 8th webinar on disaster preparedness and readiness, especially in the time of COVID-19. It's going to be great information for you. I've noticed that a few of you are not registered for our webinar on the impact of COVID-19 on the mental health of children and adolescents. It's going to be a great webinar. We've just added another dynamic guest speaker who is a doctor on the front line seeing children impacted by the pandemic in emergency rooms in LA County. You will want to hear from him. If you didn't receive an invite to the webinar, send me an email and I'll make sure that you get that invite. Again, thank you for joining us today. We know you're busy. Micki, many thanks to you for a great presentation. And a special thanks to all of you frontline advocates out there. Thank you so much for the work that you are doing. I sleep better at night knowing that you're out there. And thank you for being a voice for individuals who don't have a voice. I look forward to welcome you back next week. Until then, stay safe, stay sane if that's possible, and keep up the great work. Thanks a lot. Goodbye.